And November is Lung Cancer Awareness Month. Surprisingly, some people with advanced lung cancer never receive cancer care. In fact, a study found that they represent about 70% of all people with advanced cancer. And this may be because they think there's no hope. But Maria is talking with a doctor and a survivor who are giving them hope once again. Maria.
Lung cancer is the leading cause of cancer deaths in the United States and takes more lives each year than breast, colon, and prostate cancers combined. But lung cancer doesn't have to be a hopeless disease. Advances in lung cancer treatment have helped to improve survival from only a few months to more than a year. With November being Lung Cancer Awareness Month, we've brought on an expert in lung cancer, Dr. Praveen China, as well as lung cancer survivor don′t. Good morning, gentlemen. Thank you so much for joining me.
Good morning.
Morning.
So, doctor, what are some signs and symptoms of lung cancer?
Sure. Lung cancer patients can present with cough, shortness of breath, chest pain, sometimes coughing blood, or even just weight loss. What's alarming, however, is many patients don't present with symptoms until the disease is advanced. This is one of the reasons I've teamed up with Genentech to bring awareness to lung cancer and Lung Cancer Awareness Month.
And Don, why do you think so many people are diagnosed with lung cancer and they never receive cancer care?
I think one of the main reasons is when you hear you have cancer, it's devastating. And then to add to that, lung cancer comes with a stigma of, that shame and blame that, this is a smoker's disease and I brought this upon myself, which isn't true. And, anybody can get lung cancer. And, also that it's usually not diagnosed until the final stages of the disease.
Oh my goodness, that's very sad to hear that sometimes it's not even diagnosed till the final stages. Well, doctor, should a person who's newly diagnosed with lung cancer, what should they ask their doctor?
Sure. I think the first thing they should do is ask for a consultation with an oncologist, and that's somebody who specializes in the treatment of cancer. When they meet that person and talk to them, they should talk about the options available, the risks associated with those options, whether that with the chemotherapeutic agents or other options. And the other thing to realize is this is a team approach. So lung cancer has changed over the years. The involvement, and it involves not only your oncologist and maybe your pulmonologist, but maybe a radiation oncologist, a surgeon, to give the best options. And this is a team that kind of follows you throughout the treatment.
And Don, was that the doctor that followed you through your treatment?
When I was diagnosed, I was doing volunteer work at an institution in California, and they required a chest x-ray for tuberculosis, and that's how they found a spot in my left lung. So mine was identified by my pulmonologist, and in turn they found another spot in my right lung that was a tumor inside the bronchus tube, and my pulmonologist referred me for radiation to shrink the tumor, and then on to an oncologist for chemotherapy and Avastin, followed by an oral medication, Tarceva, that I still take today.
And Don mentions those medications. I think, again, it's important to realize that they have their side effects. Always talk to your doctor about that.
Okay, and Don, can you tell us at what stage did they diagnose your cancer?
I was stage 4.
Wow, and you survived stage 4 cancer. How was that, going through all those treatments?
They've improved a lot on the treatments from 10 or 15 years ago. It's hard, but I think what's critical is I try to stay in the best health possible. I still exercise daily, watch my diet and immune system, so that all helps in dealing with a lot of the side effects of treatment.
Well, gentlemen, thank you so much for your time this morning to talk about this important issue and the important issue that lung cancer is.
Thank you.
Great, thanks.
Don't go anywhere. The Morning Blend will be right back.